We started as a very small hospital operator with 5 hospitals in December of 1996, and we've grown by acquisition and by building new hospitals into the largest private healthcare operator in South Africa. We have some 9,200 beds. We now run the largest private emergency service, Netcare.wmv. We have about 7.8 million members there, and we run the largest primary care network of GP and medical centres. 2009 was a good year for us. Clearly, when you look at 2004, that was prior to our acquisition in the United Kingdom of General Healthcare. It was the largest transaction globally at the time in healthcare. It's been surpassed now, but it was. We now run 67 hospitals and centres in the United Kingdom as well. What you find in Netcare is that we cover the full spectrum of healthcare. So we cover it from basic primary healthcare, vaccinations, child health, HIV medicine, occupational health, through to general practitioner, dentistry, emergency services, pre-hospital services. In other words, we run over 250 ambulances. We have fixed-wing aircraft and jets that evacuate people from scenes, or helicopters, and then in hospital. And in hospital, it could be very simple issues, which are outpatient issues, or very complex heart-lung transplants, or pancreatic transplants, or other very sophisticated forms of surgery. So we provide the full spectrum of medical care here in South Africa. The private sector is contributing. We are the largest public-private partner to government in healthcare. We have a number of projects where we have refurbished hospitals, or we've got a co-location where we've put a private facility next to a government facility, and we've helped refurbish that government facility. I think that people will be blown away by the infrastructure in South Africa and the preparation behind the scenes. We've been working very closely with our own Department of Health to ensure that from a medical perspective, from an emergency perspective, from any unforeseen aspect that might occur, we're fully prepared. And there's been a lot of preparatory work. FIFA, in awarding this bid, did extensive amount of due diligence and inspection of our hospitals. So we've been with this process for a long, long time. And the time is now. It's Africa's time, it's South Africa's time, and I think that it's going to be an outstanding World Cup.